North Carolina has 23 local management entities, of which Wake County LME is one, and Durham Center LME is another. We are currently merging to form Alliance Behavioral Healthcare, so on July 1st we will form a new multi-county LME, or local management entity, covering Durham and Wake counties, and then on January 1st, 2013 we will become a managed care organization, and that enables us to manage the Medicaid funds. Right now we manage the state and local funds, but don't really manage the Medicaid funds, and we will do so in a managed care system as a managed care organization on January 1st. So a common question is, how does this affect those who are receiving services and those who need services in Wake County? We don't anticipate any significant changes. The main change is how you contact the LME to receive services. Currently, you call the Wake County call center, which is the access center, and that number is 919-250-3133. That number will remain in place and will be forwarded to a new number, which is the Alliance Behavioral Healthcare call center. But really we will be continuing to serve consumers in the same way that we have. We currently have providers in the community and give consumers a choice of those providers as they call us. We'll continue to do that, and so we really don't anticipate significant changes for consumers. In fact, our real goal is to maintain the same quality of services and the same access to services throughout the community. When Wake County and Durham County boards of commissioners were talking about merging, it was very important to both communities that we maintain local presence. So it's important to know that there's a corporate office located in Research Triangle Park, but there's also going to be a local office in Wake County and a local office in Durham County. And the function of the local presence in each community is to maintain the communication with the community, maintain the connection with our consumers, our family members, providers, and the stakeholders in the community. So that'll be one of our main roles, is to make sure that we are ensuring adequate care in our community, looking at what the needs are in our community, filling those gaps in services by developing a system of care, and also working very closely to make sure we're understanding from the consumer's perspective and family's perspective what are the needs in our community.
When they called into the number that they have been used to calling both in Durham and in Raleigh in Wake County, they will get a person in our customer service. They will be able to answer any questions they may have, or they may do a screening if they are asking for services. And at that point, they are, same as right now, they are able to do this currently. They will be given a choice of providers, and then they will be given an appointment to be seen by a provider of their choice for whatever service it is that they're requesting.
One really important addition to our array of services in our community over the last several years has been the Wakebrook campus, and that campus includes our Crisis Stabilization Center as well as the Recovery Center. These are very important services for our community. Those will remain as they are. We will continue to provide access to crisis services and inpatient substance abuse care at those facilities. We also will be working very closely with a lot of really important stakeholders. For example, the school system, the legal system, the jails, the emergency departments, primary care physicians, and many others, to make sure that we are not just providing access to services in our community, but making sure we're connecting with also very important supports.
We're in the process of hiring staff. We will have approximately 400 total staff within this managed care organization. We've hired all of the internal staff from both the Wake LME as well as the Durham LME. And we still have about 100 positions left that we'll be filling between now and October and November in the fall.
For the consumer in our community who's used to accessing services through our crisis facility, that facility will stay where it is. People can still access crisis care there, and really the services that are provided in our community through existing providers should remain unchanged at this point.